guys, my name is Ehasaas Kanjilal and welcome back to my YouTube channel. Guys, so to introduce today's guest would require a whole different vlog. He has done so much, he has contributed to the society so much that you can, listen to his successes all day long. So I'm just gonna read a few of them because I know you guys would want to know more about him, but from him. So I read you guys a bit more. He has done MD Medicine from Patna in the year 2002. He's a research fellow echocardiology from University of Alabama at Birmingham, USA 2003. He is one of the youngest fellow of Royal College of Physicians and Surgeon from Glasgow, UK, and recently received the diploma on 5th June 2019. In research, he has more than 450 citations on his many scientific research papers of cardiology, has published more than 20 international peer-reviewed scientific papers in cardiology which are cross-referred by many researchers abroad. A reviewer of application for fellowship of Society for Cardiovascular Angiography and Interventions, FSCAI, USA since 2003. He is an abstract grader in European Society of Cardiology annual conference since 2018. He has been a national faculty of many international cardiology conferences like India Live, NIC, CSI, Hyderabad Live. His paper on three-dimensional echocardiography has been quoted as standard paper, and all the protocols on how to analyze the 3D cropping images since 2004 all are first reported. He is one of the most successful doctors I know, and I am glad that he could join me today to inform you guys about the pandemic going on right now. COVID-19 is a kind of a disease who has made our colorful lives into grey. So to find positivity in that is a great deal. So all of you guys who are trying to find positivity right now, I am all for you guys. But today we learn about what actually coronavirus is, and is it something to be afraid of? And people are taking it to a whole new different level. Some are making joke of it and some are taking it to a whole new different level of panic. So what should we do during this time? So to do that, I'm calling on Dr. Aashish Sinha. I'm so glad that he could come today. He is also an observer in interventional cardiology at Mount Sinai Hospital, New York. He presently works at visiting part-time senior consultant interventional cardiologist at Bellevue Clinic in Kolkata and also in KK Nursing Home, Bhagalpur, India. It's lucky how we got in touch with him, and I'm so glad that I could get him to you. Hereby I welcome Dr. Aashish Sinha. Wait. There's another news. I'm also very proud to announce that he has been the only person from India as delegate to be invited from the British Cardiovascular Intervention Society, which is the only group of interventional cardiologists in UK. Only a handful of doctors from India represent a member of this prestigious conglomerate of specialists. I am so glad that I know him. So let's hear him and let's hear about coronavirus. Hey Dr. Aashish. So my first question to you is, can you briefly explain what novel coronavirus is?
Hi, friends of YouTube, and thank you, Ehasaas, for asking me certain questions about the coronavirus. And I believe your first question is about what is this novel coronavirus, right? Okay, novel coronavirus. Why we call it as a novel? Novel means new. So this virus, what we are talking, which everybody, the whole world is talking about, is new. It was never heard before. Nobody knew about this virus. So since it is new, we call it as a novel. Now we also call it as a COVID-19. I believe everybody is talking about COVID-19. COVID-19 is caused is a coronavirus. So what is COVID? COVID. CO is coronavirus, the virus which causes this infection, the COVID, CO. Now, VI is virus and D is the disease. So when we talk about COVID-19, 19 is 2019. So this was the time, this was the year when this virus, this new virus which was never heard before, was actually found. Now, remember, this is a virus which is not supposed to harm human beings. Actually, there are more viruses which are harmful, but it has got a typical kind of presentation. It has a, it is an envelope around it. It is an envelope and it has got spikes, and through which it attaches to the human. And this spike has this coating, has an envelope of lipids. So it has got a lipid around it and a protein around it. Why I'm talking about this kind of data, what this kind of doesn't actually going to help a lot, but it has a significance. Like when you're using a hand disinfectant, the one which you rub, you are actually dissolving the lipids, the fat part which coats the virus and through which it attaches to the human cell. So when you're using disinfectant, you are actually dissolving the lipid layer, the fat layer. So that is why it is very significant to understand that this coronavirus, the way it attaches to your body is through this envelope, through this spike, and that's why we have to know. So remember, this coronavirus which everybody is talking about is actually has come from animals. So the animal has infected human being. Now the human is transmitting this infection to human. So human to human is now going on. So it's actually a zoonotic disease. Zoonotic means it has come from animal. Now,
second question to you is, it's a very common question. What are the incubation period and symptoms of COVID-19?
okay, Ehasaas, your second question is very interesting. You want to know what is the incubation period and the symptoms of this virus, right, Ehasaas? Okay, it's very interesting. As a non-medical, you have to understand what is incubation period. Incubation is the period at which the virus doesn't give you symptoms. Means you might be harboring the virus inside you, but you are not getting those symptoms by which somebody can identify you as a potential patient of this infection, the virus, the coronavirus. Means it is the time frame where nobody knows that you are having virus inside you. This is the incubation period, and it ranges from 2 days to 14 days. So it's a huge range where you can have this this time frame where you will not be presenting with any symptoms. Maybe at some people will present with florid signs and symptoms of this infection, the coronavirus infection, which could be, I'll tell you what are those basic presentations and the symptoms. And some people might be okay even to 10th, 11th and 12th day of getting this infection. Still they are okay, and at 14th day they develop the infection. So that's why when we put the patient in quarantine, we keep them for at least 14 days just to make sure that they might develop symptoms at the 14th day. So this is the incubation period, means the virus is inside you, but you are not developing the symptoms by which your friends, families, doctors can identify you that you are again a patient of coronavirus. Okay, fine. It's very important because you might be spreading the virus to somebody else, or you might be getting infection from somebody else. In fact, it's very important to know that you might be getting infected while you're walking on road or while we are buying vegetables from people who are not symptomatic. Means they're like normal people. Like I might be shedding out viruses from my mouth, from my nose, and you might not even know. I might not be developing symptoms of the classical symptoms of this virus, and I might be shedding infection, and I might be transmitting to you and you and you. So it's very important to understand that this incubation period is a period by which you will be transmitting virus to a lot of people. Now the classical point is the symptoms. What are the symptoms of this disease? First and foremost is the fever. 80% of patients will have fever. That means 20% of patient might not have fever, but majority 80% of them will have fever. So if you have got a fever, the most important is fever, and second is cough. The cough is not productive. You might not be coughing out a lot of sputums, but it will be dry, mainly dry cough with fever. It should ring the bell. The third important point is your headache. Then muscle pain, fourth important point. And the last but not the least important point is difficulty in breathing. Very important point to consider. So if you have a people around you and somebody is telling you that they are having fever with cough, with muscle pain, it could be any viral infection. But if they complain of difficulty in breathing, there has to be a warning bell. It has to ring bell in your head, and definitely you should rush to a hospital, get to know the doctor, and find out what is actually happening. So the symptoms is very important. Try to keep in mind fever. 80% of patients will have fever. You will have dry cough, number 2. Number 3 will be muscle pain. Number 4, it could be headache. Number 5, difficulty in breathing. And there's lot of other complaints, other kind of symptoms. One is, again, some people will have rarely can have runny nose also. Some people can have vomiting, but keep this in mind. So these are the very important thing. And since I'm talking about symptom, you should know that it spreads by your respiratory droplets, your respiration, the way when you're sneezing or when you're coughing, it is the virus spreads from mainly from your respiratory way. And the presentation can be mild, can be moderate, and can be, as I told you, it could be nothing to anything. So remember, the presentations are mainly mild, moderate, and severe. And severe, I mean to say, when you are talking about severe, I mean to say severe means people can have sepsis, like septicemia. They can have low oxygen. They can go for mismatch. They have to go for ventilator also.
So my third question is pretty simple. Why is staying at home and social distancing important even for the groups who are not at high risk?
Hi, your third question is about why staying at home and social distancing important for groups who are not at high risk, right? First of all, you have to understand that staying at home is going to help you. We still don't have virus vaccines. We don't have vaccines. We don't have medicines to fight this virus. So the best way is to not get infected. And the staying at home is going to help you in keeping the virus not coming and infecting you. So if you are at home, you are not going to get infected from the other people. So that is one way that if you can avoid getting infection is by staying at home. So be at home, stay safe. That is what the slogan is we all talking about. Now remember, when you are staying at home, you are not going to get infected from those respiratory droplets which I talked about. So you can have large droplets and we can have small droplets by which people get infected when they go out. So when I was talking about large droplet and when I'm talking about small droplet, remember, like when somebody is coughing on you, it's large droplet, and small droplets are one which actually travel in the air. So you might be staying far away and you might get infected, or somebody might be sneezing on you and you might be getting large droplets, and provided you're not wearing a mask, you might be getting infected. So remember, that is one thing, that staying at home is going to help you a lot. And until and unless we have virus vaccines, to fight those viruses, we have vaccines or the strong medicine, the good antiviral medications, which the trials are going on. Definitely, probably we'll be seeing it, or we might not see it even. So until and unless we have those things in our armamentarium, we should be staying at home. That's the best way to stay at home, be safe. Now, when we talk about social distancing, what do you mean by social distancing and how it's going to help? Social distancing means you are actually not stopping the spread of the virus. You're not stopping the spread of the virus. You're just delaying it. What actually you're doing is you are slowing the spread of the virus. So when you are at a distance of say 1 meter, in India we have stick to this data of 1 meter between two people. In Canada and other places,
Sir, God forbid, if I have coronavirus, what is it that I should do first?
your fourth question, right, about the symptoms. So if I have symptoms of COVID-19, what should I do? and the first thing which comes to my mind is don't panic, because almost 80% of the people which we have seen is having very mild symptoms, means they don't have those dreadful symptoms what we have seen and what we are reading in newspaper. They might be having just mild kind of infection, just a little bit of sore throat, some kind of headache, some myalgia, just a typical viral infection. You don't have to worry. You have to understand that you are probably in the safer situation. But if you are having comorbid conditions like you have diabetic, blood pressure, other kidney disease or cancer, and if you get infected through this virus, then you might be in a risky situation and you might be falling into that 2 to 3% mortality rate data. So in that situation, definitely is things to worry. But then leave everything to the doctor whom you trust, and you should meet him, explain about your symptoms, and tell him about your travel history. So that way you can actually work on yourself. Another point I have to tell you is that if you think you might be having some symptoms of coronavirus, the first thing you have to do is to isolate yourself. You have to make sure that the moment you think that you are having some kind of virus or some symptoms, you have to isolate yourself so that you don't infect the other people. So you should have been in your self quarantine of 14 days, and in the meantime you have to inform the doctor, and they might take care of you and do the testing the way it's supposed to do. And but the first thing is that you have to make sure that you, me, or whatever, should not infect the other people. So that duty as a citizen of India, you have to make sure that you start to wear mask, you make sure your hands are sanitized, you wear gloves preferably, and don't sneeze on anybody. That's very important point to take home.
So my last question is pretty simple, but yet very, like, a bunch of people are curious about it. What is actually the testing process of coronavirus?
Okay, your last question, I believe, your fifth question. What is the testing method or testing process for the COVID-19, right? Okay. There are two way we check for the virus. One is to check for the virus itself, that if you have the virus, let me look at the virus. And second is, if you have the virus, your body has developed an antibody towards it. So we check the antibody which is developed in your body after some time. But the first and foremost way to confirm this COVID-19 is to actually check the virus itself. So the best way, the only way, what we have been doing is to do a PCR, which is a RT-PCR. We call it as an RT-PCR. It's a technique by which we detect the virus itself, the RNA of the virus, the virus itself. This is the way by which we can get the earliest detection of the COVID-19. The other stage is when your body has been infected with this virus and your body immunity has been developing antibody to fight this virus, then your body will have antibodies to this COVID-19, and then we check the antibody, which is rapid antibody test. It is not that effective because by the time we check for the antibody, you might be infecting other people. So the first, and what we have been doing in India and abroad, is the PCR, and that is RT-PCR, which is done by your nasopharyngeal swab. So what we do, we put a swab through your nose and take a swab and rotate few times and get that sample, and we can have a throat swab also. So that is how we check for the virus, and I believe that will help you in understanding this COVID-19 infection and how to check the spread. So be aware. Okay, bye bye.
Thank you so much, sir, for coming on my channel. It was truly, truly, truly a pleasure to have you. And I'm so glad that we all got informed about what actually novel coronavirus is, and some things that were unknown to us were made clear by you. So thank you so much. Hey guys, so if you like today's video, please press that subscribe button. I know today's video got a bit serious, but some of the people I know, some of my closest people, are taking it way too lightly, and I don't think that should be the way. And this video was to be informed about what actually COVID-19 is and why we should be scared of it. Not panic about it, yet we should be scared of it. So thank you so much. And if you are missing the entertainment, Sunday Fun Day is coming up soon. So please go check out my previous videos and press that like button if you like the video, and press that subscribe button and click that bell icon to never miss another update from me. And if you have any more suggestions about my next videos, please drop them down in the comment section below. Thank you so much for joining again. Bye bye. Sayonara.